Good afternoon. My name is Bill Block. I am the chairman of the Department of Obstetrics and Gynecology, and I'm a maternal fetal medicine specialist by training. I joined ETSU this time in January of 2016 and have been back now for 18 months. Prior to that, I was on faculty for 6 years in a while back, the late 90s and early 2000s, that left to go up north and then returned in January of last year. I think one of the things that we try to focus on in the residency program is making sure that we train residents that come out and are able to go into practice and are able to sustain themselves and to make a living. So the ACGME does expect us to have some training in the business of medicine. We have the luxury of having 3 physicians that also have MBAs. And I think that helps add diversity to what we're able to teach, and not only in the business of medicine, but in the leadership skills required to be a successful practitioner when you come out of training. I think that's an important aspect of our training program and something that we're able to offer that a lot of places don't have as much focus on. So in addition to learning the basic skills and advanced skills of being an OBGYN, you hopefully can learn how to survive in the real world when you're done.
We also have some great staff that assist our residents in learning CPT coding, ICD, what we're on ICD-10 now, as well as our EHR, which is all scripts. Would you like to speak to that?
I think, in our residency program, since the residents work hand in hand with the attending physicians in our office, in what is our private office, they learn how a private office works, and not only how to see patients there, but how the scheduling works, how the billing works, really the intricacies of working with a multidisciplinary team in the office, and how we hopefully then at the end of the day are able to keep the doors open. So, and the staff's a huge part of that, and a lot of them have been here for a long time and know the ins and outs much better than the physicians do.
Since your return to our department in East Tennessee, what have you seen as improvements to our program and our department, and where do you see us heading in the future?
Since I returned, we've had the opportunity to hire some really strong faculty, some people that are eager to teach and eager to take care of patients, and just have kind of reinvigorated a lot of the aspects of the department. It's always nice to be able to add people that focus just on being hospitalists. So that's a different aspect of care that we didn't have before that we now have. We've added more subspecialists. We've added physicians trained in minimally invasive GYN surgery. So the growth of the department has been not only with faculty, but with patient numbers and with procedural numbers, and a lot of the opportunity now for residents is much greater, I think, than it was a few years ago. So I think those are the positives and kind of the change we've been able to have.
And where do you see us in the next 5 to 10 years?
I think as the numbers continue to grow, it's going to be an opportunity to consider adding resident spots. Hopefully the residency program will continue to sort of solidify its patient base and add hopefully a 4th resident in each year as we grow and justify those numbers. Makes call easier, makes being off for vacation and all those types of things easier to schedule. It just makes it a more realistic opportunity. So, I think that's important. I think as we continue to grow faculty numbers, I think that's going to be a reality, and it's just going to continue to be a stronger department. Well, thank you for spending the time and listening to our approach to teaching business and medicine and leadership approaches to medicine. I think East Tennessee State has done an excellent job in improving their OBGYN residency and to bringing it to be one of the forefront in training in the Southeast, and hopefully you'll consider us when you're looking for programs.